Hello, Jim Howard here in Fort Worth, Texas. Today's date, January 2nd, 2023. Uh, our daughter yesterday brought over a whole bunch of food. She bought a new barbecue, a grill, outdoor grill, I believe. So, at least I can do is without spilling this food here. So, it's a chicken. I'm having a piece of chicken and I'm having a little bit of ribs that are left, and there's still a bunch of ribs in there. So, don't worry, I'm not going to eat in front of you. So, but don't touch the mouse because I'm coming back. Okay, I'm back. It's quite a bit later. I think the next day or whatever. It's January 3rd of 2023, and it's 4:11 a.m. in the morning. I've complained, but I'm not the only one. I mean, here in the United States, I think everybody complains about the health insurance situation, the way it works, and why we don't have, like we're, I think, 27 or 37 on the list of nations for, you know, how well our healthcare system works. I think we're either 27 or 37. There are, that's unbelievable because of our capitalistic system. It's really not, it's just politics and greed, bribery, all types of things just make the system not work the way it should work for health insurance. I've had health insurance all my life. Did I say life insurance? I mean, medical insurance. Well, let's see, the 4 years that we had a tropical fish shop, I probably didn't have health insurance because I don't think we could afford it. But when I don't want to make this a long thing, any longer than I have to. The reason that our system sucks so bad, we probably invented a lot of the high tech, I'll say CAT scanner, but probably if somebody looks it up, it was probably invented maybe by somebody in some other country. I don't know, but we have all the high tech stuff, and we have hospitals that are, and we have nursing staff and doctors and all this type of stuff, high quality. But the spending, the insurance, how that's all happened how that works is disastrous. And it's set up so that, and yet we have people here in the United States that'll say, oh, Canada has, socialized, well, some of them may say communist, and, same with the UK and everything else, just, oh, terrible, it's terrible. And of course those countries, they have good insurance. We don't. And the reason we don't have good health care insurance is greed and politics and stupidity on people's part. I spent 30 years working hospital security, and I've seen a lot, of how it fails, how our healthcare system fails people. Anyway, I have a doctor's appointment tomorrow, and every year, my health insurance company or the others too, for other, they send you your card, your new card for the. It's just so unbelievably bad, and it's been this way forever, and it's going to be this way forever until, I don't know, until we change our system. It sucks. Okay. I've had AARP, Medicare Advantage, UnitedHealthCare, that's, three different names are in there, and there's more different kinds of names on the back, healthcare plan. I've had this plan since 2010. It's 2023 now. Now, before I had this plan, I had another. I moved here to Fort Worth, I think, in 2010. So that's why you have to change. And insurance companies, they cover different areas, and you get a book. Now it's online, but with what insurance, I feel sorry. Well, I'm old. I'm 81, but I feel sorry for. Of course, there's lines you can call, but then there's also advertisements on television that confuse, elderly people and people that aren't too smart. It is, just disastrous. The book you get says, tells you how much they pay, how much your insurance will pay. Now, if there's, like a federal law or whatever that these insurance companies have to provide the minimum that you would get with that the government requires. Now all these companies, they're making a profit, and they're adjusting things so that they make a profit, but they have to give you the minimum that Medicare but then these companies can add on to their plan and juggle things around. So you just have to hope that you don't get snagged up in some type of a deal with these people. Another thing is, you think you're dealing with one company. I'm signed up with this plan, and I have been since 2010. And before that, I was in Florida, and I had insurance, down there. Anyway, so every year the insurance company sends. You have a choice. You have a chance to change, insurance plans. So this year I did not get my insurance card, the new one. And believe me, when you go to the doctor's office or to the hospital or where, you better have your card. They don't want to see you. Now they're not allowed to at a hospital or someplace like that. If you walk in with having a heart attack, they have to treat you, but they will bill you. Republicans here, in the United States, the Republican Party, they say, anybody can get medical care. All you have to do is just go to the hospital. No. If you have a serious, they have to take care of you. You have a knife sticking in your heart, or half your brain is falling out of your head or something. Yeah, they have to treat you, but then they will bill you, and the billing is unbelievable. And then they will sue you like I lived in one small town for how many years? I forget how many years here in Missouri, in Missouri, and they had a weekly newspaper, and they put in because it's a weekly newspaper and they have a small population, Bill Brown's cousin is visiting him from, that kind of a stuff, They didn't have much news, and but page after page you can see where people are being sued, and it's hospitals suing people. Gives their name, and I'm not sure if it gives their address, but it tells their name and everything else, says they're being sued. And the way it's set up is you lose. Unless you have a law. Do you have a lawyer? A personal lawyer? Do you have one that you can? You lose. So, anyway, I did not get my insurance card. And this is the insurance company here in Texas that I've had this insurance company since 2010. 13 years. Wait a minute. Let's see. Yeah, I think. And every year they send me now I have the chance to opt out. Every year they send me the card. Every year the things change on it. They're looking for, the insurance company's looking for something they can, someplace they can charge more or give you less or do something and get away with doing it, So I didn't get my, and I knew several other people who did not receive their AARP Medicare Advantage UnitedHealthCare card. And I didn't worry about it too much. And but then I have this doctor's appointment coming up, so about a little bit over 2 weeks ago or whatever, I contacted them because it's at the first of the year. It's the third now, and tomorrow I have an appointment with the doctor. Now I've been in line before, with somebody goes up, to the doctor's office and present their card, and for some reason the clerks or whatever there. That's the problem with our healthcare system, is that there's so many people involved in handling the situation. Insurance companies making them, and these various companies it's handed off to, on the back of this card, the pharmacy part of it, that's handled by 2 or 3 different, things. And the other things are handled by, you think you're dealing with one company, one insurance company, if somebody has a computer with enough, or, big enough computer or whatever, you can take over doing something. You can take over printing the card. You can take over, you can bid, and, and it doesn't make things cheaper. The UK, Canada, and other countries, it's, you go in and there's a government or something, or an insurance company, and they're taking care of the entire thing. But on the back of this card here, which is expired, and there are several companies listed on the back that do various parts of, you don't know what they do, but they do various parts of, You know, they put out the cards, I guess, if somebody bids for that and prints out these cards. And it's just a disaster. So I got when I didn't get my card for what year we're in, 2023, and I always got it early, and then I heard of some other people who, in fact, I didn't read it, but there was an article, I think, on CNN talking about major problems that I guess this insurance company was having, but probably others because they're probably the same, different name, same company, and crap. So anyway, I did call about getting my card, and I said, and they said it would be no, I tell you, I take that back. I'd always got the card. And then I saw on, they sent me an email. We're having a problem with getting cards out to everybody, and 230,000 people are not getting their cards promptly like, in the past, and we're working on the problem. And it said, you will get your card your card is being sent to you and you'll get it in 7 to 10 days. I have this appointment tomorrow, and that was cutting it close. If it was 7 to 10 days, that would have been, been close getting it. I never got it. Never got the card. It turns out that the company, maybe more than one, who knows, that makes up the cards and sends them out, they couldn't get I don't know what country they're in, they couldn't get the materials that they needed, the cards, the ink, I don't know what the crap, but 220 or 230,000, did I say million before? 1,000 people were delayed getting their cards. And I thought it was kind of strange that, the cards always had gone out at the same time. If you had a relative or somebody, well, they'd get they'd get their card one day, and a couple of days later, maybe you get your card, or vice versa, or something like that. So, and I always log into my, the doctor that I go to, I log into what's their computer thing is. It works good. I mean, it's good. It looks good. It handles good. I've mentioned some of the things I like. I can go and see when I have lab work done, it's posted to my account, my medical record there. I can go and see it. And my doctor, of course, logs in and puts information. Hey, Jim, this is much better. You're doing good, about something. But anyway, I did not receive the card. So then I called yesterday, I think it was. And I don't like talking on the telephone. And especially, I'm not anti-immigrant or people from another country or anything like that. But I have problems with, I have hearing problem, really severe, and I've had it since I was in first grade. But I called, and I hate using the phone for something like this. So I call, and I didn't get my card. So, okay, blah 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 blah. Oh, okay, well. The cards are delayed because of production problems or getting material or whatever. But let me check with this. Click, 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 click. And then it's, and I have to give them, repeatedly, the information, date of birth, all this information, Oh, well, let's see. So you're in, I couldn't understand. About every third sentence, I had to say, I'm sorry, could you repeat that? And it didn't seem to do any good, I mean, it seemed like, I didn't detect an accent, but it was kind of hard to hear. But the person didn't appear to make any, and then when I would say, I'm sorry, could you repeat that sentence? the last sentence because I have hearing problems. And she didn't really repeat it. Or if she did, like, why don't you make it, I didn't say this, but why don't you make an effort to, turn up the volume on your headset, well, not your volume, but turn up the, why, nothing. And then the lady says, well, I'm in Fort Worth, Texas, by the way. She says, well, what about your address here where you're in Atlanta, Georgia? I said, no, I'm not in Atlanta, Georgia. I've never been to Atlanta, Georgia. I think I might have been. Maybe I lay over an airplane or something. I didn't say that, Why confuse, And she says, well, and I'm having trouble every third of, and I haven't asked and repeat. And she says, well, and I told, no, that's not correct. I said, I don't know whether somebody's hacked my, hacked into my account or what. I don't know what the problem is. I haven't been to Atlanta. I don't live in Atlanta. I've been here since 2010 in Fort Worth, Texas, and every year I get the card, from your, insurance company. And I haven't been, and then she's saying, well, we'll have to cancel your insurance because you want a new address. No, I don't want a new address. I don't have an address. I've never had, an address in Atlanta, Georgia. I have been at this location with the same address, since 2010. And then and I don't have, I don't think well, maybe you have hearing problems and I have. Maybe I'm not doing good for you, but let me move this microphone a little closer. I've been forgetting to do that recently. And she's saying, well, we'll have to cancel your insurance since you want a new address. And I guess the reason for that would be that it's a new address, and these policies are for different states, and they have different benefits and stuff. And I said, no, I said such and such. Of course, she asked me my address, and I give the address, Fort Worth, Texas, slowly and everything, And then she's still saying, well, we're just going to have to rescind, she used the word rescind, I think, your thing because of you wanting this new address. And I said, no, I don't want the new address. I want the address that I've had since 2010, which is on your, your records. Well, and then she says, okay, well, going to switch you over to somebody else, which was a totally different company, by the way. That part's contracted in whatever that area that's, is contracted, and probably another area is there's another company in there. Who knows how many? Why? This is why, it costs so much here for medical care. And so I got switched over, and that lady I could understand perfectly. That was great. Wow. I was really pissed because it's frustrating, especially when you have hearing difficulty like that, and when you're having to deal. I don't like to, don't like to deal with the phone over the phone. I get her, and I could understand everything she said. She said, "Oh, okay, well." She said, "Let me look this up." She says, "Yes." She says, "You're down for an address in it." And so I explained it. She says, "Oh, wait a second. Yeah, I see. You've been with us since 2010." And she said, "Okay, well." Then she asked a few questions, to verify, that I was who I said I was, And she even acted like, which was fine. She acted like, okay, you're, and left, something out for me. She put in the wrong thing, for like, apartment such and such, I guess to see, and of course I corrected, no, apartment A. And then she said, okay, she says, I don't know where this Atlanta, Georgia came from. I'm changing that. And she says, okay, now I've changed that to your, and she then repeats everything over again, which is good, great. I'm fine with that, especially with me, with my hearing problem. And then she said, okay, now I've changed that. She says, now this is tied in with your Medicare insurance. And she says, so I'm going to log into there. And she says, they have Atlanta, Georgia also. And I said, have I been hacked? That's what I'm worried about now. And she says, oh no, I'll take care of it. And she says, okay, I changed that now. They're both, with your address now and everything. And then she says, and I said, well, my card, has expired. I haven't got the new one, and she says, yeah, the 220,000 people are having problems getting their card. She says, what I'm doing, she says, is I'm going to change your card that you have, last year's card. She says, I'm putting in now that when they run that, card, it's going to show that although it says last year's date, that it is approved, And then she said also, she says, you tell the people, if she says, do you have any medical appointments, coming up? And I said, yes, I have one in 2 days. I have one, that's going to be tomorrow, the 4th. And then I have one on the 10th. And she says, okay, well, she says, you tell them, because she said, well, I've changed everything here. And you tell them when you go there that to run that card, even though it says last year's, and it will be okay. She said, but if there's a problem, if they have a problem with that, she says, you tell them to call us. They have our number. It's on the card, And she says, you tell them to call us. And she says, I've entered in here that everything is okay, and that they'll be informed that everything is okay and that the card is okay to go. Whatever. And then she was a nice lady, and I could understand her. That makes it nice too. But I know what's going to happen tomorrow when I go to the doctor. I've even been in line before when somebody comes in like me, hey, and whatever, and they say, oh, sorry, this card is not, well, the person. And then I've been in line behind them. Oh, God, So I think tomorrow, and I don't know what to do, because I know what's going to happen. Those clerks, they're used to doing it a certain, they're used to getting a card that is a correct year, and they're just used to a certain thing that they do, and they're gonna. I know what they're gonna do. They're gonna say, well, no, this is not a new card, and then I'm gonna have to explain, 220,000 people, have been having trouble getting their cards. Cards are not going out on time. I talked to the company. I talked to the AARP, Medicare Advantage, black shit crap, whatever. And whatever their names are, And I think they're still going to say the same thing. Well, I'm sorry, you don't have insurance or whatever. I seem to remember one time, though, that I went to the same doctor's office, and I forget what the deal was. It was something odd or whatever, and they did call about it, and they said, oh, okay. But with me not having the new card, I just think that's going to blow their mind, unless some of these 220 or 230,000 people they've been seeing too, and maybe they've figured it out. But so now what I do, of course, and you can do, people can do, is I log into, the chart, my chart or whatever, into the doctor's office that I'm going to, and I have access to everything, which is neat. Even the other doctor's data goes into this thing, the heart doctor and all that, eye doctor and stuff. And but I just hope, because I'll fucking walk out. I haven't, if they, I don't know, if they can't straighten it out, and I need to go to the doctor. I've got some additional problems, and I don't go like, as often as I should. I mean, the doctor likes me every 6 months. Well, sometimes I, make the appointment for longer than 6 months or something. So, but if they say, well, we're not going to, you don't have insurance, or if they say, well, okay, you'll have to pay, $200 or something, and then you'll get your refund. You'll get a refund back if the thing, whatever. I think I'm going to just tell them, shove it up now. God damn. I don't know why all these people are trying to. Well, of course, people are coming into the United States from South America and other countries where things are really, really, really bad. And for them, this would be a minor inconvenience, compared to what they have to go through, to try to get into the United States. By the way, I left the hospital when I had my leg scratched here. I scratched it on a bed frame. It was back several years ago. And of course I let it get infected, and it got really bad, and I was in the hospital for 6 days, and I ended up leaving AMA, against medical advice. So, and if it hadn't been for my daughter Hillary, I think I would have died for sure. I won't go through that. I think I went through that one time. But I left AMA, against medical advice, and I signed a form for him. That's one thing with security that I had to deal with for 30 years. Nurses would call and say, this patient's leaving AMA, against medical advice, and won't sign the form, and I go up and say, okay, talk to the person, find out what's going on. And then I would have to tell the nurse, sometimes the patient doesn't have to sign the AMA form. I said, you can sign it, and I'll sign it that, I'm signing that I heard you tell the patient, that he shouldn't leave, and the, problems that could exist, or something like that. And different situations. I had to deal with all that kind of stuff. And in all those 30 years of hospital security, and especially when I signed the thing for the nurse, because she was real nice. The charge nurse, the one in charge of that floor, maybe several floors or something. And she was just desperate to have me sign the form and everything. And so I signed it for her. And then, as I'm getting ready to leave, I said, can you tell me the urologist that came through a few hours ago or whatever, I told him that I wanted him to be, where I asked where his office was, and he told me it's out near where I live. And I said, would you be my doctor? And he says, oh yes. He says, I'll tell the nurses to, put it on your chart there that, you're going to be seeing me and whatever. And then So anyway, so then when I come to where I'm telling the nurse that I'm leaving and why, I hadn't eaten anything in 6 days. Of course, they always come in and check to see, and of course I don't want to go through everything, they put a catheter in me, well, starting the IV thing, or drawing blood in the emergency room. And I know I've seen sometimes people have bad, veins and arteries and that type of stuff. I don't, or I didn't. I'd have nurses, in fact, I let nurses, like I let one nurse, an elderly LPN nurse who needed to stick 3 people or something like that, and she'd had the training for starting an IV, but she needed to check 3 people, and she was anxious and worried and about it, and so the supervising RN, she was the other nurse was an LPN, licensed practical nurse, and they said, the RN said, "Have you got your third stick yet?" And she, the nurse said, "No, I haven't got it yet." And then I could tell she was worried, because she was old like me. Well, no, she was older than me, but I'm older than what she was. But anyway, I asked the RN, I said, "Does it have to be a patient that, that you're," I said, can she draw, if she starts it on me, does that count as her, and she said, "Yes." And I said, "Okay." And she drew it on me and she was happy. Why did I get on that subject? I don't, anyway. Okay. Find my way back there someplace. So, okay, I was in the hospital with that, and I didn't eat anything. Oh, that was it. When I came in, the nurse, and she seemed like a really good nurse, emergency room nurse. She was drawing for lab work. That was it. I think it was that. She drew the specimen out, and then she threw it. There's a container, in all these hospital things, where you put material that goes in there to be, because it could be contaminated or whatever, goes in a special thing. I forget what they call them. I have a little tiny one in my bathroom. I'm not drawing blood every day for my diabetes, or not drawing it, but testing it. But anyway, haven't done it in months, maybe a year. But anyway, this nurse drew the stuff, and then she threw the thing into the trash, hazmat trash thing, and she, and I said, "What's wrong?" And she said, "I threw that in." And I said, "Oh, wow." I said, I couldn't be a nurse. I said, I'd be throwing that stuff in there all the time by mistake. I said, I could never be a nurse or a lab tech or something like that. And I said, I'd be doing it all the time. I said, probably happens occasionally. She said, as this is the second time, she said, only one time before I've done something like this. So she said, I need to draw again, and she couldn't get it, And then she tried again and couldn't get it. And usually the nurses, when something like that happens, will, get somebody else to, to do it, So she had a guy come over, and I don't know if he was an RN or a lab tech or what he was. He tried 4 times. That's kind of unusual. And then he couldn't get it. And then she came back, and she said, I'm sorry. I said, that's okay, no problem. I said, no problem, I understand. And she said, I'm gonna try again. And she stuck me, and she got it. And then I said, let me hold that, the thing she drew. And while you put the stuff in the trash, it needs to go in the trash. And she said, that's a good idea, jokingly, and everything. So they had that. Then I go up to the room, and there was some problems up there. Well, I had and by the way, I'm one of the least prejudiced people. I worked at a couple hospitals where I had to go toe to toe with the director of security at two different hospitals over racism or whatever, and I won. But so I'm not racist. I know I look racist, old man, white man, but so they had this black nurse, and she had an accent. And I know I came across it because I know I didn't think about it so much then, but I know I came across as racist, I'm sure. But anyway, they have a monitor up on the wall. And so when they're looking at the thing, they come in and they look at the thing up there. And this black, she didn't really talk to me, except maybe looking at the thing and saying such and such, which is a problem with my hearing, And then I trying to be friendly, and this is probably not a good idea. But I was trying to be friendly, and I said, "Where are you from?" And she said, "Africa." And then I thought, "Oh, otherwise somebody would have said the Belgian Congo, French Equatorial Africa, or something like that." And she didn't. She said Africa. And I thought, she's from that country that has the Ebola thing. That's what I was thinking, If she'd have just said, So I thought, And I think I got on the wrong. And then I think I got on the wrong. Then she came in and she was looking at the thing. They'd given me a medicine, not their fault. Well, now she had nothing to do with it, but when I went up from the emergency room up there after being stuck a bunch of times down there, the nurse, a real nice nurse, she had to put a catheter in me. I never had a catheter put in me before. Oh God. I don't know how many people as a security officer, guys that I had to hold down while they put a catheter in them. One guy came in to the hospital, and long story, but he came in and he was faking that he fell off a roof or whatever at 2 or 3 o'clock in the morning. When the paramedics arrived, they saw him. He was laying like over by the building or whatever. And then he saw them, and he didn't think that they, he didn't realize that they saw him, and he scooted around till he got in a better location to make it look more like he fell off the thing or whatever. So anyway, he came in, when they brought him in, the paramedic said, "Jim, he's pretending that he's, we saw him, blah, blah, blah." I said, "Okay." So then the nurse goes in to put a catheter in him. And she said, "Jim, I'll need you." And I said, "I don't think with this one you will, because I thought he was, well, and then the ER doctor came in. I never saw this before. This was a weird doctor. He came in, he tried to sternal, on that hurts. No response. So the nurse and doctor exchange, and so the doctor reaches down and takes this guy's testicles. And I didn't make any noise or anything. But oh God, that's what I was thinking. Oh man. And the nurses had never seen anything like that before. and the guy didn't respond. And then so anyway, Diane, the nurse, said, you know, uh, Jim, I'm going to start a catheter on him. I'll need you. And I said, I don't think you will. But I stood by, and she put the catheter in him, and I had to hold him down. But anyway, when I was in the hospital for the 6 days, no, I didn't eat anything. I couldn't eat anything. I mean, even Jell-O. I couldn't eat it because I just put it up to my mouth and have the spoon take half of the first, I couldn't do it. I felt sick, like I was going to vomit or whatever. So for 6 days, anyway, so they started the nurse, nice nurse, started put the catheter in me, and blood was going into the bag. They have to measure how much urine you're putting out, and blood was going in there, and the nurse says, well, I think some urine is going in there. I think it's, and I told her, I said, oh yeah, it's fine, I'm sure. And then hours later or whatever, I think, and I thought, and I knew, no, because I knew they would have to take it out and put it in again. So the next day she came to work. She worked day shift or something. Said, gonna have to take that catheter out and put a new one in. And I said, okay. And she did, and it hurts. It hurts bad. My ex-wife, she had polio when she was 5. We share an apartment here, and my grown son. And, when I came home or whatever, I told her, and she says, well, I've had catheters done all the time. And I said, I don't know anything about it, but I don't think they ram a 6-inch tube into you. And anyway, then with my IV and they put the new, she put a new and that one, the urine, you could see it was urine, not blood going into it. So, but this nurse from Africa, and she would always, I asked her, because they came in to give me something, I forget what, an injection of something into the IV tubing to go, and everything. And she was standing here. I didn't realize it at the time, but she had another thing in her hand. And she says, tell me if you have any problems. And as soon as she put it into the thing to go into the bag or whatever, right away, right away, I said, stop it. And then she stopped it immediately, and then she had this other stuff to neutralize that or whatever. Thank God that she did, that she was, she knew. And I was allergic, that was something so when I decided to leave AMA, about the racism thing or whatever, I was they were taking me down to different labs for different checks, and a young black young man was pushing the cart down, and I was just trying to make conversation or whatever. And I said, where are you from? And he said, I'm from Fort Worth. That's where I'm, And I could tell, that he took offense to that. He was black, by the way, so I think what the response I thought from, I didn't think he was going to say from Africa, or if I didn't think he was going to say, from Ethiopia or anything, I thought he might say, well, I'm from, Dallas or Fort Worth or something, I'm from Fort Worth, So if he had said from Fort Worth, I said, oh, if he just said I'm from Fort Worth, and I said, oh, well, I'm from Fort Worth too. I live in West Fort Worth. And then maybe he would have said, oh, I live in West Fort Worth too. I said, yeah, I would have said, I live in such and such an apartment complex. And then maybe he'd have said, hey, I live there, but it didn't, he just said, and I thought, okay, pissed him off. And then I thought, that was actually, would come across to him as probably racist, But anyway, when I go to leave AMA, the hospital, against medical advice, and I signed her form for her, which a lot of people don't do, some don't. Like I said, I spent 30 years, I don't know how many times I was called to the emergency room or to the unit because somebody wouldn't sign or something like that. Sometimes I'd have to tell the nurse, he doesn't have to sign. And I hope you don't have to leave a hospital, AMA or something, but and I've never corrected a nurse on this. Nurses would tell the patient, that who's going to leave AMA and he needed to sign this form, and the patient, I'm not going to sign. Or they'd be trying to keep him from leaving, I said she, so I'm guessing being sexist or whether there's males, RNs too, and nurses and things. Anyway, I was leaving AMA against medical advice. I signed the form for her because I knew how it was really important for her. She might have got or thought she was going to get into trouble from her. The head nurse or somebody might have said, "Why didn't you get him to sign that AMA form?" Well, I did sign the AMA form for her because, So I'm leaving, and Hillary came to get me, and undoubtedly saved my life, by the way. Not that putting in, a catheter in a couple of times hurt, and that they couldn't get none of that stuff. It was the fact that I hadn't eaten in 6 days, and the fact that they some other things that they did that I objected to. But anyway, I said, oh, by the way, to the charge nurse, I said, can I get the name of the urologist? I just talked to him a few hours ago and told him I wanted him as my doctor, and I said, can I get his name? And I said, also, there's a medication that the nurse, started to put into my IV thing, and right away I had a reaction, and the nurse did great. She stopped immediately and put in the thing to counter it. I said, but I want to make sure I never get that one again. And that was one of the things too with the black nurse from Africa. She came in, before that, and looked at the monitor, and I'm behind her, and then she's talking, and I'm having a hell of a time, hearing what she's saying. And I asked her, what's the name of that medicine that they gave me? And she said something with an accent. And then I said, I'm sorry, I have some hearing problems. She's still looking up the thing. I'm behind her. And I said, I'm sorry, what did you say it was? And she said it again. And then I said, I have a lot of hearing loss. I didn't say turn around, and talk. I didn't say that or anything like that. I just asked her again, and then I gave up. Anyway, I asked this, the nurse one for the name of the medication that I was getting, which was a $6,000 medication. I'm not sure. I'm not sure how they, if it's 6,000 an injection or 6,000 for the 7 days or whatever that. I don't know. Anyway, but so anyway, I asked the charge nurse who had signed the form for her. And I said, could you give me the name of the urologist that's going to be my urologist, and could you tell me that medicine that I'm allergic to? Could you write it down for me or something? And she says, no, when you leave AMA, we don't give you anything. And I said, you don't give the person anything at all? No. She says, no, we don't. And I didn't say, well, I spent 30 years, I didn't say anything like that because they didn't want to, they wouldn't want to hear it. I didn't say, well, I spent 30 years working hospital security, and I never, ever heard of that. I didn't say there's a joint commission, a thing called the Joint Commission that does inspections of all hospitals in the United States every other year. And I didn't say, well, I think I'll be contacting the Joint Commission and see if that's policy, because I knew it wouldn't be, That's just plain stupid. But anyway, I went home and I could log into my medical record, which is really neat, and they had the name of the urologist on there, and they had the medicine that I had the problem with, and I had all that stuff so I could get it. But one reason that Hillary saved my life was, she went to see about getting my prescription from the local pharmacist, and they said, we can't get it approved. I forget what all, because, it's a $6,000 medication. We can't get it approved. And I forget what the thing was. And Hillary, she's pretty persistent. And she actually got the pharmacy technician, or I think actually the ones there I'm not sure they're technicians. Well, they probably are. They probably had some training. But she actually got that young lady, calling around to get the medicine for me. And Hillary said that technician, Hillary was talking to the technician, or to the pharmacist there at Walgreens. Not the pharmacist, but the lady at the counter, And that the lady was actually crying, I guess, I'm so sorry, I can't get your father help and whatever. They got it taken care of, and I got the medicine, and I survived. The nurse from Africa, when I left, they didn't do anything. Hillary was there, and Hillary helped me get out of the bed, and then as we walked by, she was sitting outside the door, because that lady nurse from Africa, she was sitting outside the door, and she said, what was it? I wish you good luck. And then I just went on, and we got around the corner. I said, really, that was not necessary. She was thinking I was going to die. And because that's, so. I got some stuff I need to do today before my doctor's appointment tomorrow, and I hope it goes okay with the check-in. But I know it won't, because generally those ladies, I'm trying to think of, you don't want to clump everybody together, and I'm sure, but those ladies and I'm guessing they probably have a guy in there too, maybe, but the people that check you in or whatever, I think they have an attitude. And I think, they're going to say, no, your card is, last year's card. And in spite of all I'm going to tell them, hey, they said they activated this card because they didn't get me, that it's, and then also that you could call them or whatever. I think that's going to be a problem. Maybe I'll get somebody really nice or something. It seems to me like when I go to the doctor that I go to, coming in, well, they've been polite too and everything nice, I was going to say. But it seems like when I'm leaving, you know, and I come up to the counter before you leave. They want to check to make sure that, you know, that you have an appointment for your next, you know, and that kind of stuff. It seems like they're extra nice. Like maybe because you're leaving, they're thinking, thank God this one, you know, we're getting these people out of here. But anyway, I want to thank you very much for watching this video.